So now we have the second wave of COVID-19, and in addition, there's also news of the second variant of the virus. Just what will this mean for the safety of healthcare workers and others? We're joined by Professor Adrian Puren of the National Institute for Communicable Diseases and Zola Saphetha, who's the General Secretary of the union NEHAWU. Good evening, and thank you so much to you both for your time tonight. Zola, I'm going to begin with you. Certainly yesterday, we heard from the Health Minister saying this, there is, of course, cause for concern, but we shouldn't panic as South African as they've now discovered this new variant. What's your reaction?
Good evening, Bongiwe and the viewers. We heard the minister that we shouldn't panic, but of course we must be worried as trade unions, precisely because the announcement happened amidst the findings on the N95 that are used by frontline workers whose authenticity is questionable in terms of quality from the findings that were conducted. So the variant, as announced yesterday, we have not understood what kind of animal it is, and we should be worried really. And the worries that we have will make us to panic because workers are vulnerable, they are subjected to this virus, and now their complication arises as a result of the variant at a time where we're still studying and also trying to engage government to provide qualitative protective clothing, particularly masks that are to be used by those who are at a high level of critical patients in relation to COVID.
And Prof, if I can bring you in as well, I'd like to ask you the same question because it does appear that Zola, as of course, representing the healthcare workers, that are affiliated to his union, they are concerned even about PPE around the second wave. When I know that you work very closely at the NICD with the health department and the scientists. How worried should South Africans be? Because as much as the minister and the scientists were saying yesterday that they're still going to do their utmost best to try and make sure that they contain the situation, it does look like this new variant has caused some panic.
Yes, I think there is always concern. So we have been monitoring throughout the world this particular virus and seeing how it is evolving. I think what is unique about what has happened here in South Africa and I think in the UK is that there have been a multiple range of mutations. So mutations ordinarily occur in these particular viruses, but this time around there are some critical mutations that have occurred. However, I think what is important to emphasize, and that is the point what my colleague has raised here, is that in fact this reinforces the need for us to continue to ensure that the non-pharmaceutical interventions such as the appropriate PPE, the wearing of masks, the hand hygiene, all of those, the ventilation, for example, especially in hospitals as well, those remain. And in fact, this should encourage us to continue to have all those particular aspects in place. This virus is transmitted efficiently already. We're going to reach 1 million cases in the next few days. We have mortality in this country, over 20,000 deaths. So even though there are these particular mutations, this virus is transmitting quite well and effectively. However, more needs to be done, and I think that was certainly emphasized. We have the mutations, but what will they mean? In other words, in terms of the clinical outcomes with regard to transmission as well, these are questions that still remain to be answered, but our current approach to managing this virus still remains, and we must emphasize those key aspects around the PPE, the ventilation, the management of patients remains unchanged at this particular time.
And Prof, when you look at some of the questions that are still not answered, it does also, look like we still don't know if those that had COVID-19 in the first wave can be reinfected.
Yeah, so those are the types of questions we have to answer. But even if we had not had these mutations, I think it's still a challenge for us to identify reinfections. There have been some confirmed reports because we've been able to sequence the virus at the initial infection and the second infection to see that they are different. So this still remains the approach. Whether or not this particular virus will lead to greater reinfections, I think is still unclear. So I think we still need to understand whether or not the antibody responses are going to be any different. And again, we can certainly test some of these particular challenges within the laboratory by using, for example, the various panels of people that have been previously infected to determine whether or not it will neutralize the current variant that is being observed. So we can certainly generate answers, and I hope that some of these answers will become available soon, over the next month or so.
Zola, you mentioned PPE, and Professor is also mentioning just how important it is going to be that health workers and also get the correct PPE. This is a fight that has been ongoing between yourselves and officials in this particular area. What really is the holdup when it comes to giving healthcare workers the correct PPE?
Just before answering that question, following on the last question you asked, Prof, maybe Prof at some point will speak about it. One of the issues that is not spoken about is the after effects. After having contracted the virus, you end up with chronic illness, and we don't know what the extent of that chronic will relate to the reinfection. I'm sure part of the things that scientists ought to look into is that impact. And I'm saying that because frontline workers, many of them have been infected, hospitalized, but others have recovered and so forth. Amidst with that is this fake masks that are given to frontline workers at a critical point of service. We don't know what that thing means. But generally, coming back to your question, is that we have been, as you know, we've been at loggerheads with government, taking each other to court, emphasizing the need for PPEs, conducted effect findings, and we made some suggestions as a response. And that makes us to be worried more because in the first wave, the government said the same thing, we must not panic. But the numbers as it relates to frontline workers increased. And the president of the country, he also made the point that health workers are not immune from the infections. They are growing as hospitals are being full, and there's no space for us even to breathe, and we can't even sleep enough so that we can wake up tomorrow and deal with those issues. And we still have this shortage. And the truth of the matter is, this is a battle that worth to take. And we have just completed a strike asking government to absorb community workers, which are critical in this period, and that has not happened. We're left with no option but to fight and defend the lives of our members, who, in fact, will have to defend the lives of their families. But we'll continue to engage with government. We'll use this festive for purposes of engaging. And if anything doesn't come forward, then we'll be left with no option. Rather, ask our members to keep themselves at home to protect their lives.
All right, I'd like us just to pause this conversation for now. We'll continue on the other side of this. Our conversation with Professor Adrian Puren and Zola Saphetha continues after the break. Thanks for staying with us. We're back with Professor Adrian Puren of the National Institute for Communicable Diseases and Zola Saphetha, who's the General Secretary of the union NEHAWU. And we're talking about the second wave of COVID-19 and, of course, that new variant that has now been discovered and how this is going to affect healthcare workers and others. Prof, before we went for the break, Zola raised something very important, and I saw a thread on social media about this particular subject, looking at the after effects of people who have had COVID-19. Others were talking about the fact that months on, they still aren't able to taste anything. Others are talking about respiratory issues that continue and all these after effects that then continue.
Yes, that's quite correct. So there's this term that is used, the sort of long COVID or long haulers, and the virus not only affects the respiratory system, it affects multiple systems, whether that be the brain, the heart, the gastrointestinal system. It affects multiple systems, not just one particular system. And some of the effects will recover. For example, the sense of smell may well return, because we know that it probably affects and kills off those particular cells around smell, and so they may well return. But there are other effects that we still don't fully understand, that is currently being explored. So my colleague is quite right. If you look at the United States, the UK, there certainly have been more systematic efforts in order to try and collect information from patients who come back and say, well, I've been declared recovered, but I have, continuous symptoms around, say, mental symptoms or neurological symptoms or respiratory systems or cardiac disease. And so in South Africa, I think there are efforts coming along. I know that there's a system called COVID, or DATCOV, sorry, that's looking at patients specifically, or will be looking at patients that have these particular symptoms so that we can have a more systematic approach and understand, how long and how to manage these particular patients. So you're quite right. That, if you like, is the second or the third wave around this epidemic. It's not just simply that we have the disease, we have recovered, but in fact, it's also important to know how many people have these long-term effects, how to manage them. That's going to be a very important and key question for South Africa as well.
And another key question, Prof, is also going to be just if there are any new symptoms that could then be seen at the back of this new variant that has now been discovered, and whether or not it could affect the vaccine that, the different vaccines that have now come into play.
So my sense is that based on the fact that this new variant has been in circulation and is the dominant one, I've not seen any reports that there are different clinical presentations. I think that is fairly unlikely. We know from a diagnostic point of view as well that the way in which we are diagnosing this particular disease has certainly not been affected by this new variant. The important question you raise is around the immune response. Will it be different, and how different will that be? So again, if we look at where those mutations are they really critical for vaccine responses, and will those responses have to, the design of vaccines have to change? But I think there's some key work, fundamental key work that needs to be done in terms of looking at, for example, what we call convalescent serum from those who have been infected with the previous variants or lineages, and seeing how the virus behaves there, as well as looking at those individuals who have participated in the vaccine trial, who received the actual vaccine, the vaccine, to see again how those panels respond against this particular variant virus. So those are still key fundamental questions that need to be answered, and they're critical questions. You're quite right.
And Zola, when you listen back to what the minister had to say yesterday, that this variant appears to be driving the second wave in South Africa, when you look at the hospitals and the capacity, are they ready to cope with the surge that we're seeing in cases and hospitalizations?
Truth to be told, our government is still behaving like we are confronted with the first wave, because from our experience and recommendations we made in our fact-finding, we're making it in anticipation for the second wave. but there is no much movement as it relates responding to that. As you will know, that in one hospital in East London, they did not have enough beds. As a result, those who were brought by ambulances were kept in ambulances because there's a shortage of beds, and the standard and the condition of hospital have not improved. So our general, and I just read an article yesterday that indicates that almost in KZN and Eastern Cape, hospitals are full, and we don't know what will happen after festives, whether hospitals will have a space as they are confronted by challenges now. So we are yet to get a report from our members as we are interacting with them, but also expecting to have a discussion with the department in terms of the plans. You see, one of the disappointing reality is that department is planning far away from us, people who are experiencing these things on day-to-day basis, people who would have used their experience to advise far better than what the government is doing. But we are yet to meet the government, but we are collecting information hospital by hospital, province by province, and collate that and present it for discussions.
And Zola, when you look at what has also happened in recent weeks, and we saw that Rage Festival, we saw quite a number of events, and that led to then the nightmare of contact tracing, and even the Gauteng department saying that over nearly 1,000 of these young people that attended that Rage Festival tested positive. There's also quite an extensive contact tracing list that then they had now to deal with, and they now even trying to trace some of them that had given the wrong details and all of that. All of this, of course, is putting a strain on the healthcare system. Do you think there isn't enough that has been done to hold those that are organizing such events to account, because some of them continue?
Look, there ought to be consequence management. At the level of awareness, as far back as March, we have been trying our best, civil society together and government, in bringing awareness to society and also educating them about the nature and the pace of this virus, and also encouraging them to apply and consider the measures that are put in place to manage a spread of this virus. But those who are still continuing, there ought to be serious consequence management, because they are putting a lot of strain, not only to hospitals, but to health workers as a whole. And these health workers ought to sacrifice their lives, do their job without adequate, protective clothing, because we will not encourage them not to attend to people as they come to hospitals. And also, we will also be worried about their risk that they take for themselves and also for their families. So we need to tighten up really restrictions, but also more importantly, consequence management, because there's much that has been done at the level of awareness, though, and I'm sure Prof will speak about it, though we pick up one of the weaknesses as part of the awarenesses, because there has been an emphasis that this virus is more vicious in winter, as if in summer we will not be seeing it. And unfortunately, the second wave has proven us wrong, and hence the behavior and the conduct of society as a whole, because they have been orientated to a belief that is only existing now is in summer. And we see a significant growth just between 30th November and today. 996,000 that have been infected, which are new cases, just in 18 days, and 2,750 deaths. So we should be worried. That is why those who are careless, who are playing with the lives of others, ought to be dealt with as such.
And Prof, what do you say to that?
Yeah, those are really critical points. So I understand that even at province level, there are supposed to be resurgence plans, and we have a way to monitor at district and sub-district levels to really understand what is happening around this particular epidemic. And the districts are expected to develop, and have already, I hope, developed their resurgence plans in order to manage this. So the approach is not just to apply a blanket lockdown, but to look very carefully at each particular scenario as to why these events occur. For example, if there are rage events, or if there are funerals, or if, for example, malls do not manage appropriately, or there are mass events that occur outside of the norm. These are areas which need to be managed appropriately and stopped in many cases, but also the risk communication is really critical. I agree with my colleague there that, we went through the step down in terms of making mobility greater because we had the economy in the front of our minds. That's really important, but we need to manage our risk. That's really going to be critical for us in order to try and prevent transmission, in order to prevent the hospitalizations that we're currently seeing, people ending up in ICUs and actually dying. So I think we need to keep perspective, all of us, that it's not just my health, but it's the health of everyone along that chain in my family, where there's an intergenerational setup and there are older people, people with comorbidities. All those messages need to come back that people have possibly forgotten and reinforced. Yes, you're right. You're quite right. I think people thought that this is going to be like the flu. This is not the flu. This virus has been transmitting throughout, even now during our summer months, and we are already experiencing a surge. I think you're quite right. Communication, engagement with the communities is really going to be critical, and especially those individuals who have a responsibility for our safety as well. We are personally responsible for our safety, but there are those around us who also have to play a critical role around managing our safety, and they need to take this responsibility very seriously.
And Zola, when we talk about these the resurgence plans and how each district is meant to have one, have you caught sight of any of these resurgence plans, and are they foolproof, and are you satisfied as NEHAWU that enough is being done here?
Unfortunately, since June, we have been asking institutional plans to respond to the virus, including necessary contingency plans or resurgence plans. To date, we have not received it. The only thing that we got was what the government is telling us is their plan. And as long as communities in districts and organizations with constituencies are not brought into a platform and be taken through on the nature and the pattern of this virus in a manner that in their own space they are able to speak about it, will run into trouble, because this is not a matter of government, it's a societal issue if we are to win this virus. But as long as we want to monopolize purely to the health aspects and the health system, we are going to run into trouble. As trade unions, we have established workers' platforms or forums. We are speaking about these things, particularly on our experiences at the hospital, and extend it to those who are not in the health sector, for them to be able to be aware, but also to take a responsibility. So as far as the plans, we are still looking for those plans since June.
It does look like, this is a conversation that is not going to end here. Thank you so much for your time tonight. I certainly do appreciate it. That was Professor Adrian Puren of the National Institute for Communicable Diseases, and Zola Saphetha, the General Secretary of Union NEHAWU.